I am. Hello, everyone. I am here and I'm going to go over a good portion of what is important when it comes to Medicare. And I want to make sure that you are getting the information that you need. All right. So I am Kayla Price, and we are going to again focus on a majority of what is important with Medicare. And of course, if you have any questions, certainly let me know. Again, Kayla Price, my insurance agency is Price Services Group, and that is your email address. And I'll provide our phone number and other information at the end. All right, so a little about me. I am a licensed insurance agent with an extensive and in-depth knowledge and experience when it comes to Medicare. So what I like to do is make sure that my clients understand Medicare, that they're enrolling in the plan that's important to them, which whether it's in a Medicare Advantage, Medicare Supplement, of course, with the needed prescription drug coverage as well. And the main thing I want to do is make sure we're maximizing benefits for you. I am an independent insurance agent, so that means that I'm not tied to a particular insurance company. My goal, again, is to make sure that you have the plan that works best for you. And so a lot of times you all may have a lot of plans that you've heard about. You're not sure what a deductible is. There may be a lot of spam calls and mailers and, of course, TV commercials. But when working with me, you don't have to worry about all that. We help you cut through the noise. And I also have a professional team that's backing me to make sure that, again, your needs are being taken care of. All right, so who do I help? Well, I do assist clients in different scenarios, whether you're turning 65, whether you're under 65 and with Medicare, whether you're older and, just have some type of insurance, whether it be through an employer of your own or your spouse, or any other type of insurance and making sure that you know what your options are for Medicare. If you're not sure if you want to stay on the employer insurance, you want to go over to Medicare, or have both. I'm here to help with that as well. If you're unhappy with your current coverage, I'm definitely here to sit down with you and see again what your options are, show you those options and help you with making an informed decision. Then of course as well, if you are on Social Security disability, I can assist you. All right, so let's dive into the A, B, C, and D of Medicare. So what is Medicare? It is the U.S. government's largest health insurance program and serves over 66 million people. Medicare, again, is a federal health insurance program. It is for U.S. citizens and legal residents, and then also is an individual health insurance. So it's not like a group insurance. It is one plan per person. Now, Medicare is not Medicaid, it's not Social Security, it's not a family plan. So who can get Medicare? You can qualify for Medicare if you meet one of the following requirements. So if you're within 3 months of turning 65 or older, even if you're still working, again, you could qualify for Medicare. If you're younger than 65 and you have a qualifying disability, again, you can qualify for Medicare um, long as you're having Social Security, disability, and then going through 24 months, then in the 25th month, you qualify for Medicare. If you have end-stage renal disease or ALS, again, you also can qualify. So what does original Medicare cover? Again, this is Part A and Part B of Medicare. So first is Part A, hospital insurance. That's the hospital room and meals. That's the intensive care. That's skilled nursing care, operating room services, hospice, rehab, some home health care. Again, that's typically tied to a medical condition that you've been treated for. that Medicare has helped cover the cost. Some drugs and medical supplies during the inpatient stays if you're in the hospital. Part B is your medical insurance. So this will be doctor's visits, annual wellness visits, and preventative services. This will also be outpatient care, mental health care, clinical lab services, also durable medical equipment, ambulance services, and occupational physical therapy. Again, you can't be denied coverage. Coverage is nationwide with Medicare. Um, Sometimes there can be some confusion with doctors' offices, and typically what I do is step in and help resolve that issue between the doctor's office and the insurance company. So what does Part A and Part B cover? So again, Part A and Part B is original Medicare. There's no out-of-pocket maximum. So I tell people it can be 20% that you're paying of 200,000. It could be 200. Again, there's no maximum. So we definitely want to keep that in mind. Understand too that premium free is if you or spouse has worked 10 or more years, you've paid in your taxes, they've taken out Medicare from that. If you don't have that 10 plus years or 40 quarters, then you likely would not have premium free Part A, in that you could potentially pay up to $518 per month for that. If you're in that situation, I can still help you, certainly. Just let me know. And then if you are an above average earner, there is a higher premium for Part B. All right. So what are the premiums for Part A and Part B? So zero for most people for Part A, and then everyone has to pay the 185 per month unless you're receiving help with paying that. And that could typically be someone that's on Medicaid, whether it's full or partial. You could have that 195 paid if you qualify. The deductible for this year for 2025 is $1,676 per benefit period for Part A. A benefit period is typically 60 days. Um, and then additional time after that, once you've gone without care, you get a new benefit period. Typically, and then if you go beyond the 60 days, there could be some other costs associated with that. So, 419 per day, day 61 through 90. And then if you went beyond that, it'd be 838 per day. And then that would go into what they call a lifetime, benefit part of it. But most people don't get to that point unless someone's really sick. Again, if there are situations where that is taking place, you can certainly look at that. Now, the deductible on the Part B for 2025 is 257. It could go up, could go down for next year, just like this. Medicare typically decide what those amounts will be for the year. Same with the Part B premium, and they typically let us know towards the end of the year what that would be for next year. And certainly we can let you know what that would be. Now, under Part B, this is the 20% I mentioned. There's no limit or maximum on that, what that could be under Part B. Now, I did mention income. So these are what we call income brackets listed here. So you'll notice for individual, for those filing jointly or those married and separate, you start at a base of 185. Typically, if you're married but filing separate, you are going to have to pay a higher amount at a lower income bracket than if you were filing jointly. And again, this is largely based off of the income that you've earned and will be on your tax returns. Now, of course, everybody's situation is separate, and those with higher incomes, there are some things that we can take a look at to see whether or not we could potentially get a lower Part B premium. Certainly let me know if that is something that you would need, and we can certainly take a look at your individual case. All right. So next, we're looking at what is not going to be covered. So typically, what is not going to be covered under original Medicare, that would be the cost of care that you go beyond, those core coverage areas. Plus, if you have prescription drug coverage that you need that's not going to be covered under original Medicare. And again, keeping in mind that there are services that are not covered. So again, that 20%, the maximum, that 20% is what you have to pay. And your prescription drugs, of course, as well as annual physical. This is not the same as the annual wellness. Annual wellness is typically questions that'll be asked of you to determine what your current condition is and how things are going forward. Dental, vision, and hearing care is also not covered under original Medicare. Hearing aids are not covered. Eyeglasses and contacts are not covered. Um, unless you have, now if you've had a cataract surgery, you can potentially get a pair of glasses through Medicare. But if it's just like routine eye exam and then you want to get eyeglasses and contacts, it's not covered. Long-term care is also not covered in the original Medicare, and then most of your care outside of the U.S. will not be covered. And then I do have this note here again. The annual wellness visit is once every 12 months. It is not a physical exam. It's a health risk assessment questionnaire. So there are questions that will be asked of you, and also doing a cognitive assessment. So getting more coverage. So there's two ways that you can do that. So there's the set it and forget it approach, and then there's the pay as you go. So for set it and forget it, you're still enrolled, of course, in the original Medicare. Then you're going to add on a Medicare supplement or Medigap. This helps cover those out-of-pocket costs, so that 20% that you would typically be facing with no maximum under original Medicare. The Medigap plan steps in to help cover that after you've met your deductible. And then some of them do have copays, and then some don't after you've met your deductible. So also you add on the prescription drug coverage. So whether you're going with the Medigap or whether you have the Medicare Advantage plan, you're going to have some type of prescription drug coverage, whether it's you're going to the VA or you're still working and you have a work health insurance plan and you're just adding on some extra coverage through Medicare. You're going to have a plan, and then again, Medigap plus some form of prescription drug plan, whether it's a Medicare prescription drug plan or if it's a plan that's through work or through the VA. And then pay as you go. So this is where you're having the Medicare Advantage plan, it steps in place of original Medicare. And Part C or Medicare Advantage is combining the Part A and Part B into one plan. And then two, you can also have prescription drug coverage included. And then you can get additional benefits such as dental, vision, hearing, and there's other benefits as well that may be possible through some plans. Again, that's something we can definitely sit down and look at for you. All right, so what is a Medicare supplement? So you pay a monthly fee or monthly premium in addition to your Part B. Again, you have to keep your Part B regardless of what plan you go with. And it's a private plan that does cover the cost of original Medicare, so it steps in and pays at 20%. There are 10 plans that are standardized by the federal government that are offered by the companies, so regardless of what company it is, there's standard features or benefits in the plan. Now, the monthly fees can vary depending on plan type and state. And then some plans may offer additional benefits, where there is no drug coverage or dental or vision hearing, for most of the Medicare supplement plans. There are some that you can either add on, dental, vision, and hearing, or they may offer discounts. There's no medical underwriting for up to 6 months after you've enrolled in Part B, whether it's at age 65 or you're older. It is guaranteed renewable as long as you're paying the monthly premiums. And then two, you do have nationwide coverage. There's no provider network. Okay, so your Medicare supplement, what does it cover? So again, I mentioned there's 10. So typically A is going to be the same across the board for most companies. And then with C and the F here, if you turn 65 before January 1st of 2020, then you can access these plans. If not, if you turn 65 afterwards, then these plans are no longer available. So most people do either go with the Plan G or Plan E now. Some may go with some of the other plans as well. And so we'll look at the Plan G. So typically with Part A, you'll see it pays the hospital co-insurance, hospice care co-insurance, medical co-insurance, preventative care co-insurance, as well as Part A and Part B, blood. Then too, with skilled nursing, so it helps, cover that Part A deductible and the Part B deductible. Um, Down with, well, with Part B deductible, you would actually have to pay that. Once you've paid that, then they're covering the rest of it, up to 100%. It also covers excess charges. There are some states that do allow, um, providers or doctors' offices to charge more than the Medicare amount. That's what the excess charge is. And then if you're, traveling, it'll cover, up to 80% of that cost if there's an emergency, and the lifetime limit is typically going to be $50,000 that they'll cover between Medicare and between the plan. Now, with Plan N, the biggest difference between that one and G is the excess charges. So N does not cover excess charges, whereas G would. And, that's the biggest difference. Now, if you turn 65 before January 1st of 2020, the biggest difference between the Plan F, and the Plan G is Plan F typically does cover the deductible, the Part B deductible, but typically what I'll find is when you do the analysis of the cost, the difference between the two, it's usually better for you just to go with the Plan G and then, pay out that deductible because these premiums can be pretty high for a plan with most companies. There may be a few that aren't as high as others. Now, we'll take a look at the Plan C or Medicare Advantage. So here you have all the benefits of Plan A and B, and you're still in the Medicare program, but the plans are going to be offered by private companies. So most plans do include prescription drug coverage. There are some that are considered medical only, and those are plans that I'll look at for people in situations where they have other prescription drug coverage. Now, many plans do offer routine dental, routine eye exam and eyeglasses, hearing tests and hearing aids, as well as wellness programs. And then two, as far as the cost goes, so of course you still have to pay your Part B plan premium. Um, your Part B premium, that would be directly to Social Security, whether it's taken out of your Social Security check or you're paying it. Now, of course, if you're paying it directly, you can pay each month or per quarter. Now, many plans do come with a zero premium. There are usually out of pocket costs, whether it be co-insurances or co-pays when you use the services. Again, pay as you go. You paying each time you use the plan. Um, some things may be a zero premium. Um, and the ones that are not, of course, you're paying for those who use the service. So typically there's also an annual maximum out of pocket. I typically tell people you're not going to hit that unless you have a bad health year. If that is a concern, there are some ways we can look at, trying to minimize the cost as much as possible. And even in general, there are certainly ways to minimize those costs. If you're just not wanting to have, to deal with the possibility of paying out a lot of money. Other factors to consider. So some plans may require a referral. Many don't, but there are some that may. And then also coordinated care support. So most carriers now have a care team that's available, especially if somebody has chronic conditions or somebody has Medicare, Medicaid. And then even if that's not the case, there are some carriers that do have care teams available for all members. All right, so what about Part D? Well, this is your Medicare prescription drug coverage. So, private plans typically cover the cost of prescription drugs and maybe, of course, co-pays and co-insurances. But as long as the prescriptions are on the plan, then the plan does help pay for those prescriptions. So most of your common medications are going to be covered. Some of the specific brand names and generics may or may not be covered. Plans typically have guidelines they have to follow on what they have to include on their plans. Vaccines are not going to be covered under Part B. A lot of times, some may, but most aren't. And then in those cases, those will be covered under Part D. And then how it works is you do have a monthly premium if it's a standalone plan. If it's a Medicare Advantage plan with prescription drug coverage, if there is a premium for those types of plans, I've typically noticed that's coming from the drug coverage on those plans. And in either case, the average premium is about $56. And then there are co-pays for each medications based off of the tier. So the higher the tier, the higher the cost potentially. With the exception of some plans, what they'll do is they'll put the diabetic supplies like a tier six. In that case, there's typically not going to be a copay. But again, it's plan specific how they handle that. There could be a deductible as well. Again, you typically find out on higher tiers, with the exception of diabetic supplies for most plans. And then two, there is a specific pharmacy network. Again, prescription drug plans can be standalone or they can be included in a prescription drug plan. Again, if you're in a situation where you have other health insurance, then of course you can sit down and take. So just like with Part B, if you have a higher income, then typically there's going to be an additional amount added depending on the income. Again, if you're married, filing separate, you'll typically have a higher premium that you're paying at a lower income. Again, if there are questions about trying to minimize that, definitely reach out and we can take a look at your individual situation. All right. So As far as coverage and formularies go, so here again, you could have an additional premium that you're paying for prescription drug coverage. And then too, there is usually a copay, or copay or co-insurance for your prescriptions, depending on the stage that you're in, and then also the type of prescription. And then, so during the year, we have different stages. So the annual deductible, if the plan does have a deductible, it can't be any more than $590. Not all plans will have a deductible, but for those that do, it can't be any more than 590 for this year. So once you have met the deductible portion, whether you have one or not, then you move to the initial coverage. So here, the insured, which would be you all, will typically pay like a 25% co-insurance for covered prescriptions up to $2,000. So once the $2,000, and that also includes anything the insurance company pays, once that amount is hit, you're done. And then it would move over to catastrophic, where then the insurance company, the manufacturers, and others that are involved, including Medicare, would divvy up the cost of those prescriptions for the rest of the year. Again, typically you'll notice like your tier one and tier two, usually those don't have a copay. A copay, if they do, is not really high. If it's a higher tier, that's typically where you're going to find those copays. But if it's a diabetic supply situation, then normally there's not a copay with that. Again, the formulary. So this would be drugs that are grouped into those tiers. And again, the lower the tier, the lower the cost. You can also reduce prescription costs by either using mail order or preferred forms. Again, if you have questions, certainly let me know. So the changes that were made, so 2023, these were the percentages. So Medicare was paying 80% in this first phase. Um, the plans are paying 15%. You all, as the enrollees, are paying 5%. Um, at the top here, plus an additional 25% here. Then you hit the threshold and went into coverage gap. 70% drug manufacturers, about 5% would be you all, and then would be the plan, and then you all would do about 25%. And then Medicare, of course, would also have to pay a portion too. So Medicare was like that. We need to make these changes um, on how much is being paid out. So 2024, you all, again, the top 5% was no more. Medicare was still paying about 80%. The plans were paying about 20% here. And then in this phase, you have the 25%. Okay. So Medicare was not happy with having to pay the 80% up here. And most people, I will say, stay towards the bottom, like the deductible and then initial phase. So, the people who were getting higher cost prescriptions are normally the ones that would hit these higher phases. So, what they did with the Inflation Reduction Act is lower the total cost that you all would end up having to pay. So you'll see here, $2,000 is the most, and that also includes anything that the plan paid as well. So here in the deductible phase, enrollees, you all would pay the 100%, and that's just the same as before. Then the plans pay about 10% less, with the drug manufacturers actually paying more than they did before in this phase. And then 25% again here near the once you've gone through deductible and into initial. So again, once that 2000 is hit, you all are done. And then it's between the plan, the drug manufacturer, and Medicare to divvy up those costs. So again, timeline is Part D vaccine coverage did expand, so that actually lowered the cost share for a lot of vaccines. And then two, insulin savings. So the cap of $35 a month. I will say this was for insulin that is on the formulary. So it's important to make sure that you're taking insulin that's, and then 2024, again, if you hit catastrophic for the remainder of the year, then you were at zero. That was that top 5% I was showing you all. Um, that helped lower costs last year. And then this year you had the cap at $2,000. So again, once you had the $2,000 hit, you're done versus 8,000 last year. It eliminates the coverage gap or donut hole. And then that was this part here. So that goes. And you again go from initial to catastrophic this year if you have higher costs. Eliminating the coverage gap was big because when people fell into the coverage gap or donut hole, they were paying still a pretty high amount. Changes as well to how much Medicare was paying, so going from 80% to 20% in the coverage, and the catastrophic. So here, 80% for 2024, 20% in the catastrophic phase, for 2025 moving forward. So, as well as changing those costs, there were changes to plans. So it did raise some premiums, made fewer plans available. There are stricter formularies, and then there are more utilization. So whether it's a prior authorization, step therapy, or quality limits. So what I tell people is the changes on the drug side did also change the medical coverage on some plans. And again, if you're not sure what's going on with your plan, if your costs have gone up, then certainly reach out. We can take a look. So making a decision. So option one, again, set it and forget it. That's your Medicare supplement and your prescription drug plan. So everything that original Medicare covers, understand that there is a premium for the Medigap and there's a separate premium for the drug plan. It can lower the out-of-pocket costs, and then any doctor that accepts original Medicare also accepts Medicare. Typically, what I'll tell people is you can show them the Medicare supplement at the doctor's office. If they give you pushback, let me know, but just let them know that the bill will first go through original Medicare. Again, option two is your pay as you go. So again, everything covered under original Medicare plus additional benefits. Typically, you'll find a zero premium. Copays and co-insurances are, and, something that's a part of the plan. So you pay as you use the services. The maximum out of pocket is about 7,550 on average. There are some plans that are higher, max out of pockets. Some plans may also require referrals, and then some you may only have in-network coverage. Again, if there is a question, I certainly can make sure that we're taking care of that for you. All right, so what should you consider? As everything goes, it is a personal decision of what you go with, but there are a few things to think about. So are you willing to pay premiums, deductibles, co-pays, co-insurances? Does your plan that you're considering have the benefits you're looking for? Is dental vision hearing important to you? Are you okay with having a more restricted list of providers and hospitals that are in network? Do you feel comfortable with the plan managing chronic conditions? Also consider there are special needs plans. So typically that could be based on a chronic condition like diabetes or heart conditions. Could also be based off of Medicaid eligibility. And then two, if you live in a nursing facility, there are specific plans for that as well. And or if also if you live in assisted living, there are plenty of options available for that. Understand that there's also financial assistance available to you. So that is based off of income and assets. So that could be Medicaid. It could be a Medicare savings program that reduces your Part A and Part B costs. Could be extra help. That's a program through Social Security. Again, if you have questions about that, let me know. There also are additional local programs that may be available. Again, if you have any questions about that, I certainly can help you. Now, enrolling in Medicare, to understand, typically this should be your birthday month for age 65. You have 3 months before that you can sign up for coverage to start that month, or if you miss your birthday month, you have up to 3 months afterwards. And this is saying that you're able to do so without there being a penalty. But if you even miss that, then you could very well have a penalty for enrolling late. So how you enroll in Medicare, if you're not receiving Social Security, then you would go to Social Security's website, so ssa.gov, to sign up for your Part A and or Part B. If you're currently receiving Social Security, they're automatically signed. So definitely enrolling in Part A. Some people do delay Part B if they're still working. If you're still working, it could be better for you to be on Medicare coverage. It may not. It just depends on your situation. Again, that's something that we can discuss. Take a look at the coverage options available. That way we can see what would be a better plan for you for your so a Medicare supplement, so there's 6 months after you turn 65 or older and you've enrolled in Part B that you have to apply for and get a Medicare supplement without going through medical questions. Again, guaranteed renewable as long as you're paying your premiums. So again, you have that 6 month runway after you're 65 or older and having your Part B. Now, of course, if you're under the age of 65, and you're applying for it to be effective the month of your 56 of your 65th birthday, understand that it'll become effective the month of your 65th birthday. And again, if you're approaching 65, definitely speak with me. If you're older than 65, speak with me. If you're younger, and have a Social Security eligible disability, speak with me as well. I basically tell people if you have a red, white, and blue card, I can help you. If you don't and they qualify, I can still help you, of course. If you're working past 65, so again, 3 months before or after you turn 65 is that golden window for most people. But of course, if you've delayed, you can still apply for coverage. It's not going to be an issue. So typically you can delay without a penalty if there are 20 or more employees at your workplace and that coverage is considered credible. If there are fewer than 20, then it's not going to be considered credible at this time. Um, if you're covered by a spouse's employer, the same rules apply. And of course, if you needed to delay, if that's something we discussed and that was the better move for you moving forward, um, certainly we can take a look at that. A lot of it too, again, comes down to employer rules and coverage is available. There's some employers that won't cover spouses, 65 and older because they are now eligible for Medicare. Again, that's something we can look at. So if you're after your 65th birthday and enrolling, so there are some situations, so if you've delayed and haven't signed up for Part B, again, you have time to get coverage. If you've signed up for Part B and you're losing coverage, again, we can still get you signed up. So if you've delayed, you may be enrolled in Part A and or B. Um, you can then look at Part C or Medicare Advantage plan or standalone if you're going with the supplement. Um, if you're enrolling in your supplement, you must do so within 6 months of getting Part B and being 65. So here we go. This is, whether you're leaving employer coverage, at 65 or afterwards. So you have this 8 month runway. It's called a special enrollment period. Okay. And, you do, and so Medicare supplement, you have that, runway there. So typically you'll find as well, you have 2 months after you left coverage to sign up for your Part A or Part D, your Part C or D, Part D being your prescription drug coverage, Part C being your Medicare Advantage. So again, if you're thinking about leaving employer coverage, retiring, going to another job. Otherwise, let me know. We can look at options as far as your health insurance because I wouldn't want you to miss your enrollment. All right, so you can always change plans as well. Um, if it's a Medicare Advantage or prescription drug plan, that would need to be done typically during the annual enrollment period, October 15th through December 7th. If you have a Medicare Advantage plan, you have an additional time frame of January 1st to March 31st to change your plan. So annual enrollment period, you can switch into or from a Medicare Advantage plan, join, switch, or drop a prescription drug plan. If you're in the open enrollment period, again, Medicare Advantage members can switch or drop coverage. Special enrollment periods typically take place throughout the year. It could be that you move, lost coverage, qualify for a special needs plan, receiving assistance or having some other qualifying event happen. So again, if there's any questions about that, let me know. Now, the main thing is you don't want to sign up late. So if you sign up late for Part A, there's a 10% penalty. If you don't qualify for premium free, if you worked your 40 quarters or your spouse has worked 40 quarters, then you're fine. Um, Part B, 10%. This would be if you don't have a special enrollment period. So say you're not losing employer coverage. That is a penalty that sticks your Part B. Part D is 1% of the current average premium, and that again can fluctuate from year to year. And this is if you missed your window to sign up for prescription drug coverage, typically 63 days, you've gone without what's considered credible coverage. These are some terms that are typically associated with Medicare. You don't have to know all those. I, again, can help you with any questions. I do want to thank you for your time today. This QR code lets you get in contact with me. You can also call or text either of those numbers. If you text webinar or scan the QR code, you can get that online webinar, and certainly also reach out for an appointment if you'd like one. If you do the permission to contact, I'll follow up with you. If you're new to Medicare, you can get a copy of the new to Medicare guide. If you're already on Medicare, then you can get a guide as well. And then I have additional guides available as well. Again, my name is Kayla Price. Price Services Group is my insurance agency. This is our email. Again, you can call or text either of these numbers to get in contact with us. Thank you for your time, and I look forward to speaking with you. Take care.